So, so just to set the context for everyone, I think today's session is about moving beyond the whole discovery and the shock which we've had on account of COVID. I think a lot of us will agree that this is fait accompli. And the objective of today's session is about how do we deal with this confidently going forward, hence the title COVID Confidence. And I'm sure all of you are awaiting eagerly on guidelines and tips, both from Dr. and from Anil, as to how do we deal with this health issue. Before I start the house rules, if all of you stay mute, otherwise I'll be forced to mute you, so sorry about that. But your videos can be on, that's not a problem. We also have a set of questions which a lot of you people have sent to me and Anil, and Arun and also Anil. So we're going to post those questions right in front of you on the screen as well, so you can see that. And Doctor, you can refer to some of those questions as you are going along.
Sure.
And as we are progressing the conversation and the discussions, those members who want to post the questions, please use the chat box to your right. I'm sure everybody is now a Zoom graduate over the last 3 months. So Doctor, first let me begin with you. We all know that COVID is here, it's going to stay with us for a foreseeable future. And each one of us have our own interpretations, rightly or wrongly. And there is a whole spectrum of behavior. At one end, there is outright fear amongst us. And at the other end, there is abject denial that everything is fine and this will go away. And somewhere in the middle, people are either abundantly cautious or they are indifferent. And some of them are taking calculated risks. I'm perhaps one of those who's beginning to step out and started working. So if we exclude the far extremes of fear and denial, and if we sort of focus somewhere in the middle of the spectrum, what would be your advice, Doctor, based on what you have observed, learned, and treated? What should we be doing firstly in terms of preventions and some actions, some hygiene points? I think if we can begin with that, it would be very helpful.
Thank you very much. First of all, I would extend my profuse thanks to you personally and the TiE for having given me this opportunity. It's pleasure and delight to be with you all. And I'm sure all of you are so enlightened that probably regarding COVID, you must be knowing much more than me. But I'll share some of the relevant information which will make you very confident in life, which will make your living happy. But I'm sure all of you must be loaded with the COVID knowledge. And but I'd like to give you the most salient feature that will imbibe confidence in you to lead a better quality of life. This is the only issue which has witnessed a tremendous upgradation of the knowledge, tremendous awareness has picked up, and tremendous level of confidence is picked up. So what happened, if you look at the month of March when we started having COVID problem, then our fear psychosis was sky high and confidence level was lowest. Now our confidence level is built up and the fear psychosis is coming down. So this has been the biggest change in last 3 months, the building up of confidence of handling COVID and leading better quality of life, and fear psychosis is going down. But this is the bottom line of our experience. What you said to me, that just let me give a preamble of this COVID infection, that this is a kind of a respiratory infection which is viral in origin, and it affects the lungs mainly, but it affects the other parts also. Why we are so worried about COVID? Because it's a highly contagious, little unlike the swine flu all of you have faced about it. Now, because of very contagious nature and because of a peculiar symptomatology, and last but not least, that no specific antidote or drug is available till now, lot of modalities are available now and we are confident to handle it. So these were the few issues that it made us to worry about the COVID. Now, it is a highly infectious disease to the extent that it spreads through the droplet infection and it affects the population at large. Giving a little background of COVID, even if someone contacts the infection, I must bring to your knowledge that 70 to 80% people are either asymptomatic or they have mild symptoms like any cough and cold, a natural viral cough and cold. And these people recover or they don't have any visible symptoms and they come out of this situation without any consequences. So 80% people are safe. That gives you enough confidence building input to you. Secondly, around 15 to 17% people are one who develop mild complications. Most of these complications are respiratory complications. Patient might have mild pneumonia, patient might have fever, and whenever lungs, which are meant to maintain the oxygenation of body, gets affected, the oxygen levels in the body goes down. So one of the important method and the tool of investigation is the pulse oximeter, which we look for oxygenation of the body. So whenever there is a 15 to 17% people, they develop pneumonia and some complication, they might require hospitalization, they might require treatment, and they would also come out successfully after the COVID symptomatology is over. The challenge is only in 2 to 3% patients. Who are these 2 to 3%? I must share with you all those who are 60 to 70 plus senior citizens, because immunity is compromised. Briefcase. Immunity is compromised. All those people who have comorbid conditions, like any person who has diabetes, who has hypertension, who has cardiac problem, who has liver problem, cirrhosis of liver, the kidney problem, asthma, or he has a cancer, or he's on certain long-term drugs which affects the immunity. So people who are elderly, who are immunocompromised, there this virus has more grave complications and they fall in the category of 2 to 3% people, and there our skills are tested, our endeavors are tested, and we are trying now to save those 2 to 3% people. So to begin with, the good news is that 80% are mildly or asymptomatic. 15 to 17% people, they recover very well if treated well in time. They report early before complications takes place, go to a better center of treatment. So challenge is only 2 to 4% people where certain protocols have to be followed, and that's the reason. So we begin with a feeling that it is treatable, it is recoverable in most of the patients, except those who are challenged people. And I'll tell you what those people need to be careful of so that we take care of the fear psychosis of the COVID. I can't hear you. Chirag, I can't hear you. Your voice is mute.
Can you hear me? Sorry.
Yeah.
So as a follow-on question, doctor, given that this is possible and a lot of them may get it, so I think the biggest question in most of our minds currently is that how do we deal with this in terms of identification, in terms of treatment, in terms of management? What would be?
Yes. First of all,
I'm calling you in the middle of the night. What are the other things we would do?
Yes, I tell you. First of all, most and foremost is the identification. What are the symptoms? What are the signs of COVID infection? So it begins not only with the sign and symptom, but it begins with your contact history. If you have traveled in a red zone, if you have come in a contact with who is a COVID person, if you have gone to hospital, or if you have come in contact with any COVID suspect, then history is very important. So you need to be careful about it. Definitely, recently I got a chance to see a lot of people who visited some families in the wedding. Recently, one of the family I am attending, they have gone to Agra for a wedding ceremony. They did not go anywhere. So the history of contact is very important if you have traveled. Secondly, why history of contact is important? Why we need to have mask? I'll share later with you. If anyone has a COVID infection, that's a fact. I'm sure all of you like to know about it. If suppose anyone has a COVID infection, the source of COVID virus is in throat and nasopharynx. When a person speaks, simply speaks, he throws 20 to 50 viruses while simple speaking in the air per minute. So suppose if I have COVID positive, I'm COVID positive, when I'm talking, I will be throwing 20 to 50 viruses in the atmosphere. If I'm masked, I'm protecting contamination or atmosphere like that. If I have a COVID infection and I'm sneezing and coughing, mind it, if sneezing and coughing, my throwing of virus load in the atmosphere will be to the tune of 1 to 2 crore viruses per minute. So when I'm simple speaking, I might throw 20 to 200, from 20 to 200 viruses per minute. But if I'm coughing or sneezing, if I have a COVID infection, I would throw 1 to 2 crores, that is 10 to 20 million virus particles in the atmosphere. They are microscopic particles. And to get contaminated with COVID positive, you just require inhalation of 1000 virus particles. See how careful you have to be. So if you have inhaled 1000 virus particles, you are enough liable to contract the infection, while a simple cough and sneezing of a positive patient throws into air that is 10 to 20 million, 1 to 2 crore virus particles. So this is the way you need to be very careful, and history of contact is very important. Secondly, anyone who has a history of contact or travel, it could be an unknowing contact, like you're going to grocery shop or a fruit shop or a barber shop or saloon, or you come in contact with a stranger, etc. You need to be careful. The common symptoms are, you might have little soreness of throat, you might have little cough, you might have fever. So the standard trilogy of symptoms, this is standard protocol, is cough, fever, and later breathlessness. So initially you might have mild cough with irritation in throat. You might or might not have fever, and after 2 or 3 days you find that you get little breathless. These are the alarming symptoms. You should report to your doctor immediately. But in addition to that, you can have non-classical symptoms. I just, for academic reason, I must tell you, this virus affects a particular kind of receptors in the body known as ACE receptors. This is more of a medical term I'm using. So naturally, virus has a choice for a particular kind of site or receptor which are located in the breathing pipe. But similar receptors are also located in your stomach and intestines also. So we have seen the patient with the COVID coming with pain abdomen, coming with diarrhea, coming with intestinal perforation, coming with attack like appendicitis, coming with distension of abdomen, coming with headache. Some people might come because they affect the GI tract, the food pipe tract. Some people might come the change of taste. Some people might come with change of smell, etc. So you need to be careful of any atypical symptom you have. It will be prudent to be in touch with your doctor. Fine. So standard cardinal features are cough, fever, and breathlessness. But these are the minor symptoms you need to be very careful about. Now, next question comes. Suppose you have these symptoms. One of the very important thing is that every one of you need to have a pulse oximeter at home. This is a pulse oximeter, you know about it. It shows the oxygen saturation of your lungs. Normally, it should be more than 90 to 93%, and commonly it will find around 98 to 99%. You should recover quickly. If you recover quickly, the saturation maintains at its original level. But if the patient continues to have symptoms, or patient is likely to fall in those 15% who might not recover quickly and he might develop pneumonia, this saturation, which was a 98, 97, starts falling. So if at any stage you are run fever or cough, or if you are COVID positive, if you find the saturation falling down, you should meet your doctor immediately. Another way of testing is that if you have fever and cough, always take the resting saturation. Remain sitting, you see the oxygen levels. After that, ideally you need to walk 6 minutes. There is a scientifically quotation of 6 minutes. But if you get breathless, you may stop walking before. But if you walk for 6 minutes and if your saturation stays the same, you're confident that your lungs are safe. But if you feel that if you're walking 6 minutes, your saturation falls down by 4 to 5 millimeter of merc, what is being shown here, then definitely you need to contact your doctor, which is very important. Another very important thing is that you need to have 3 things which will prevent a spread. As I said to you, that if someone has COVID positive, he may be asymptomatic, standing in the queue at the fruit shop or the grocery shop, maybe ahead of you or behind you, you need to have mask. So even if someone has loaded atmosphere around you with the viral particle. If you have a mask, they will not enter in your face. Secondly, what happens? These virus particles thrown into air by anyone, they settles down in the hard surface. We call that fomites. If these viral particles fall on the shining hard surface, like tabletops, the handles, the sink, the dining table, the railings of the hotel or the office, they may remain alive for 5 to 7 days. Remember, that's the difference between COVID and swine. The viability of the virus on hard surfaces up to the 5 to 7 days. Why? What is the logic of hand washing? That you may accidentally touch the railing, you may touch the table, you may touch the handle of the room, and that's the reason it is very dangerous and risky to go to restaurant these days, because we don't know whether the tables have been cleared or the cleaned very nicely. Who don't know who are the visitors before. So this virus on the fomites can be picked up by your hands, and accidentally when you clean your face or put your fingers on the face, on the nose, you may inhale the virus. So you need to do masking of yourself, hand washing. When we talk of hand washing, any soap is important, and this virus has a fatty cover. So if you wash your hand with the soap, it has to be washed all around the back of the hand, between the fingers. If you are wearing half sheep skirt, wash up to the forehand, etc. And so that the covering of the virus get destroyed. You can use the sanitizers also. So you need not to wash every 10 minutes, 5 minutes. You need to wash when you feel that accidentally you have touched your hand somewhere, so you clean it up. And lastly, the distancing. It is very important to have distancing. Suppose if a person speaks, suppose a person coughs or sneezes, the virus particle can be thrown into the atmosphere up to 3 to 5 feet. So suppose even if I'm standing in front of a COVID positive patient, he's been sneezing or coughing. If I'm 8 feet away or 1.5 meter away, even if he throws virus particles in the atmosphere, they settle down. So the droplet virus particles gets into the atmosphere up to 3 to 5 feet, truly speaking up to 3 feet, but if a profuse cough is there up to 5 feet maximum. So you maintain a social distancing. You don't let the virus particle touch you or touch your body or touch your clothes, so that you don't carry those viral particles home. You keep a mask so that you don't breathe those virus particles, and you wash your hand once you come out from house or anywhere, so that even if you accidentally touched the virus particles laden surface, you clean it out. So you need to be very careful about your accidental contact. You need to be very careful about the standard 3 symptoms of cough, breathlessness, and fever, and minor symptoms I suggested with you. And you need to have these 3 cardinal features, so that even if you don't know in community who is positive and who is not positive, because 80% being mildly or asymptomatic, so at least you protect yourself.
Lovely, thank you. That's very insightful, Doctor. If we now go to the remaining 20%, I guess everybody is proactively thinking about what if we get it. So what are some of the things, if you see...
now, very interesting. First of all, I want to convey to you that we have the latest modalities of treatment available. Can you believe we had 38 patients in our ICU in last 5 days with no mortality, no death. So we have got so many modes of treatment available, so many modes of treatment investigations available, that I can reassure you, you need to be confident that yes, doctors can manage this, so you need not to worry about it. Only thing is that we need to protect our parents and grandparents who have comorbid condition, so we need to really take care of that. Now coming with that, I must share with you, you belong to a city which has the most premier institute SMS in the country. Truly speaking, the government of India has conveyed this SMS model need to be followed all over country. We are the pioneers. When the first COVID patients came, as I shared with you, that no specific treatment for COVID is available now. So we were the first to create a bridge between a point of no treatment till the specific drugs will be available in due course of time. So we used a combination of latest drug, hydroxychloroquine, and anti-HIV drug. There are 2 antiviral drugs, lopinavir and ritonavir, and probably all our 3 patients survived by a first time using the antiviral and hydroxychloroquine, and which was picked up by whole of the world. And we started getting a lot of queries from United Nations also, which are still being used. So any person who has a mild fever, cough and breathlessness, as you said, those falling in 15 to 18% patient, it will be prudent to go to a doctor. Earlier we had a COVID Institute SMS, but now it has turned into non-COVID, and we have taken over another institute known as RUHS. Now, whenever a patient with a suspected COVID symptom comes, he is thoroughly investigated. We need to find out the complications much advanced. The category of the COVID patients are four. One is the asymptomatic, second is a mildly symptomatic, third is a moderately symptomatic, fourth is a severely symptomatic, and lastly is the critical. So we adopt a approach of very early diagnosis and proactive approach in mild to moderate. So patient comes to us with the mildest symptom, he should go to hospital, and we try to investigate to find out what complications of COVID patient has developed. How these patients are managed, I'll just share with you. All these patients who have a mild to moderate symptom, what is the advantage of going to hospital is that these patients are subjected to X-ray, but you'll be astonished to know that hundreds of patients have normal X-ray, but if you do the CT scan of chest in earliest phase, you may find the patch of pneumonia. So all these patients are subjected to CT scan of chest, which take just 1 minute to find out the early pneumonia. They are subjected to ultrasound of lung, which we have been doing to find out the patch of pneumonia. They are subjected to echo, and all these patients, along with having the pneumonia and the COVID, there is a chemical storm in the body known as cytokine storm. What is this chemical storm? Certain toxic chemicals are liberated in body by COVID. All of you must have heard COVID pneumonia ventilator, COVID pneumonia ventilator. But I must share with you, in our institute, we kept 300 ventilators ready with 1,000 bed, and at the peak of season, we used only 10 ventilators. So common man thinks, I think all of your knowledge, COVID pneumonia ventilator is not that. The pneumonia is one complication, but at the same time, certain toxic chemicals are produced in the body. This is known as cytokine storm. And fortunately, we were the first to use estimation of these toxic chemicals in body in SMS. These are known as, just for your knowledge, interleukin 6, interleukin 10, interleukin 1, the TNF alpha, D dimer, and a lot of latest scientific investigations are available, and we do. So you'll be surprised, all these 15% people, they don't have only the pneumonia, but they have micro blood clot in the lung. So what happens, we do the pulmonary angiography of these patients, and day one we start putting them on the blood thinning injections. Day one we start putting on the latest drugs available these days in India. These are monoclonal antibodies and antiviral drugs. Fortunately, ours is a one institute. We have been using everything latest in the world, and we start taking care of those toxic chemicals. We start using antiviral drugs, which is causing the pneumonia. So it is not only the pneumonia by COVID infection. COVID infection leads to the small blood clot formation in the lungs, which we manage effectively. There are certain toxic chemicals are produced in the lungs, which damage heart, which damages brain, which damages lungs, which damages kidney. So we take care of that. And we are the pioneers to start the COVID plasma therapy, which we give in these 15 to 17% patients who are moderately ill. I must tell you something, what is COVID plasma? When a patient who recovers from COVID-19 infection, fine, he develops certain immunity in the body, and his blood becomes full of antibodies against those COVID. Just like in a patient of anemia, you do the blood transfusion, fine. Similarly, those patients who have recovered from COVID-19, their blood is loaded with antibodies. These are known as COVID antibodies. Now, if these COVID antibodies are taken from the COVID recovered patients and given to those 50 to 17% patients, they recover very fast. These antibodies in plasma, which is given to the patient, they kill the virus. So what we do is that we maintain a list of people who recover from COVID. After those people who are discharged from hospital with the COVID recovery with 2 negative symptoms, we give a gap of 14 days. So after 14 days of a COVID recovery patient, we contact all those patients. And these days we have been doing intense appeal to all COVID recovered patients. Our success rate is 15 to 20% only. 2 out of 10 agree to our appeal. They proactively come forward for a plasma donation like a blood donation. So we are thankful to them, and we continue to appeal those people who are recovered to give their plasma to treat the newer incoming patients. Once the patient gives a consent after 14 days, we do a repeat again COVID test done to make sure they are not harboring any active virus. Once we are convinced that the fellow is not harboring any COVID active virus, we test their blood for presence of antibody. And once the antibody presence is confirmed, we take 200 ml of plasma of the COVID recovered patient. This plasma is full of antibodies against COVID virus. And this we give to those 15 to 17% patients who are admitted with us with moderate degree of COVID pneumonia or COVID complication. So these modalities of treatment we use for 15 to 17% patients, and we try to bring them out of the crisis, and they improve, and their oxygenation improves, their parameters improves. All these modalities we use in those 2 to 3% patients also who are very critical, but because of their other critical issues of uncontrolled diabetes, uncontrolled of heart problem. Just now, an hour before, I admitted a 49-year-old boy who is a owner of a sweet shop, very popular sweet shop. I admitted with the COVID positive, and his sugar was 359. So along with the COVID pneumonia, he had a challenge of uncontrolled diabetes. So these are the person who really need to be handled very aggressively. But I must share with you that you are staying in a town where every possible modality of treatment is available. SMS Jaipur is a part of a solidarity trial. I'll share with you. The WHO is conducting a trial world over, solidarity, and you must have heard a drug known as remdesivir. There's a lot of talk about remdesivir, a drug not available in India. People have been talking about remdesivir, very costly drug, not available in being America. We have been using that remdesivir in our institute also. So every possible drug in the world, along with the plasma therapy, we have been using in those 15 to 17% moderate patients and 2 to 3% critically ill patient. But still, my suggestion to everyone is that let that stage not come. Mask, the social distancing and hand washing should be that it should not let you fall in these 15 to 20% patients.
Thank you, Doctor. Another related question, and if you see, some of them are posted on the screen as well. How do you, for those 18-20% of people, how does home quarantine as a tool fit as part of your treatment protocol?
Yes, yeah, is a brilliant question. I'm telling you, there's been a new change in policy of home quarantine. Home quarantine is brilliant for COVID positive asymptomatic patient. I'll tell you later the protocols of home quarantine. So home quarantine is brilliant for 80% asymptomatic COVID positive patient. Fine. I'll tell you what do's and don'ts for home quarantine. All those people who fall in 15 to 17% mild to moderate, up to mild also, but if you are young, you have some family to monitor you, you are techno savvy, you can monitor yourself, and you don't have any compromise in symptomatology, even with the mild symptom of COVID positive, you can be allowed for home quarantine. People with the moderate symptoms who are reasonably breathless, who are running high fever, who has a cough, who have a comorbid condition like diabetes, hypertension, they should be in hospital. So people with no symptoms or people with mild symptoms or any patient whom a doctor thinks that he can handle himself, is not a critical one, they can go on home quarantine. Now, what are the prerequisites for home quarantine is, A, you need to have a separate space at home so that you don't mingle with the rest of the family members. You should have a separate bathroom. You should be techno-savvy or literate enough that you are able to monitor your oxygen saturation and be in touch with the medical fraternity through the telemedication or the video conferencing. You should have easy accessibility, or you should be in touch with a hospital. In case of deterioration of symptoms, you can immediately go there. If possible, you should have an access to nursing care at home, and you should have resources to meet out the medications and the testing at home. So if you have these facilities available at home for asymptomatic or mildly symptomatic or a lesser degree symptoms, if a doctor feels satisfied, home quarantine is beautiful. But there are strong protocols because you have to protect your family. You need to have a laundry of your bedroom separate in a separate bathroom. You have to have the dinner, breakfast, lunch and dinner delivered at your room. outside and you have to pick up and bring inside. You cannot have luxury of someone serving you, treating you. You have to have the mask all the time. The family members have to have a mask all the time. So there are certain protocols of isolation has to be meticulously. Remember, what did I say? That simple breathing of a positive patient throws 20 to 200 virus particles in the air. A mild cough or sneezing will load your home with 10 to 20 million or 1 to 2 crore viral particles in a home. They will fall on the surface, they'll fall on your hard surface. So protect your family, which is very important.
Thank you. And for those of us who, if we end up in the hospital and, like Anil did, how do we make sure that our family, our next of kin, what do they need to do? How do they engage with the patient or with the medical fraternity?
You know, the basic challenge we are coming across is whenever a patient goes to hospital, you'll be surprised. We have got 242 patients today. Can you believe? Even the families withdraw. The best of the families withdraw. After all, the medical personnel and health personnel get exhausted. I give you this morning, the best of the people who were admitted them, we offered their family that we are giving you PP kit, we are giving you N95 mask, we are giving you all protective shields. You can go, take the breakfast for your family, take the lunch for your family, go and meet your family member inside, go and check. No, 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 we'll not go. You only look after. So what happens? It becomes a real challenge for medical fraternity. Even the families withdraw. Like I give an example, out of 240 patients today, only in spite of motivation, 80 patients are there whose family is bringing their meals, going inside and delivering them. 160 patients from all spectrum of the society, they withdraw. No, whatever is there, you manage to them. So family participation is very important. We have used some NGOs. You know, you learn over the period of time. Initially, we had a lot of challenges. Nursing staff was having a lot of fear psychosis. Residents have a lot of fear psychosis. Doctors have a lot of fear psychosis. You'll be surprised in SMS, we have got 97 doctors, nursing staff have been affected by COVID. Today only, in our department, 4 doctors have been found to be positive who are looking after ICU patients. So that fear psychosis has gone down. So the advice for patients who are in ICU and hospital, that they should be in touch with the family. They should be in touch with the doctors and nursing staff with their phone. These days, what we have been doing, we have been taking phone numbers of all the patients inside. Doctors and staff, they go, interact with them, but we talk to them on phone every few hours. The family should talk to them on every few hours. They can share their issues with the doctors. They can share their issues with the nursing staff. The family can have all the protective gears and they can go with them. The younger people who can go with them, because you know, medical fraternity is there to treat in the best possible manner. The nursing staff is there to treat in the best possible manner, but they are also human beings. You can hear their fear psychosis, their worries, the stories of almost so far in India, 28 doctors and nursing staff lost their lives. In UK, 150 doctors and nursing staff have lost their life. So fear psychosis so much. So I think here the participation of the family, consoling them, visiting them once a day with all protective equipment, meeting out them, it is also very thing. So one of our challenges is that I think in good number of percentage of patient, family abandons them, the patient, at the mercy of doctors and nursing staff. Okay, you look after them. They are doing the best of the jobs, but then you cannot handle such a big mass because the people get exhausted. But yes, I think you should be in constant touch with mobiles, video conferencing, FaceTiming. So there's some diversion and de-stressing of the patient also.
Yes, I think that is very important. I think we as family members have to support and come forward and with the medical fraternity. One final question before we deal with some of the other questions which are there on the screen, Doctor, and we'll obviously get Anil to give a perspective as well from his point of view. But in terms of new antigens and antibodies, that's a very good question somebody has raised. What is your opinion in terms of the science and the development?
Now, I tell you, someone is probably referring to the antigen and antibody test.
Yeah.
The gold standard for diagnosis of COVID is RT-PCR. That is a test which is done by taking the sample from the throat or the nasopharynx. and we document the gene, we document the RNA virus. This is the most specific test. But this test also has a limitation. If you take the sample from the nose, it is correct to the tune of 70%. If you take sample from the throat, it is correct to the tune of 58 to 60%. So make sure, even if someone might have COVID positivity and he may fall in the 30% and giving a false positive, false negative. So someone might have COVID positive virus harboring in throat and nose, but the sensitivity of this test is only 70%. So still the 30% people who have COVID virus may turn out to be negative and they can infect with the family. So you need to be careful that when you move out, please keep mask. Even if someone may boast that my friend is tested COVID negative, doesn't matter. Your friend may fall into 30% lot. So better you keep a mask. Now the other test which has come is the antigen test and antibody test. Antibody test is a surveillance test. All of us, sooner or later, we are going to be infected by air infection and we develop resistance to that. I give you the best example. You will go to a spicy food shop and you'll come happily with no issues. Any one of your friends and family who's come from US after 20 years, moment you will take them to a spicy restaurant, next day they will have tummy upset. Am I correct? Because they are not used to that level of infection or the type of food, but all of us have antibodies against that kind of food. So that's the reason over the period of time, all the people are going to be in touch with a viral infection and they are going to develop the antibodies. And this antibody test is done. Suppose my antibody test is done because all the doctors are exposed to all the time in the 24-hour. All of us come in a low category risk. All are in low category risk because we stay 24/7 in a viral atmosphere. Our institute, which has a 250 patient, you can imagine the number of virus load in the atmosphere. So we are going to develop the antibodies against that. And if the test is done for those people who have been exposed to the viral infection, they will show the positive antibodies. It is a kind of surveillance. So if anyone has a positive antibody test as is being done in US, it means he can be sure that he has developed the defense system in the body. A new test is in pipeline that is known as antigen test. Just like RT-PCR test, which takes 4 to 6 hours, there's an antigen test which is in pipeline but not has been validated by Government of India, that this can be done any roadside or any camp or any area. Just in a 15 minutes, they will take a swab from the nose or mouth and see the antigen present or not. This can be done, but this is yet to be validated. So these tests are there, but the gold standard still continues to be the RT-PCR. There's been some new guidelines also. You must have heard that people who come from quarantine from abroad, they stay in the quarantine for 14 days and they can go home if they have no symptom without testing. So there's been new quarantine that have you come in contact with someone, you have 14 days no symptoms, because the incubation period of this test is 2 to 14 days. If no symptom 14 days, you can mingle without test being negative. So no issues there. So there are 3 types of tests available. RT-PCR is a specific test which is being done, and there are antigen tests yet to be validated. Antibody test shows the exposure to COVID thing, but not yet validated in our country.
Right. And in terms of the testing facilities, doctor, in Rajasthan and specifically in Jaipur, you feel that there are enough, not just
We ratio-wise, population-wise, efforts-wise, we are better than Europe and America. There's a very strong statement. Can you believe we started with 0 test, and today SMS alone is capable of doing 4,500 tests. Can you believe we do this test in free in SMS, which costs 3,500 in private lab? Another 15 days in SMS, we'll be able to do 7,000 tests a day. And so far, we have ourselves already tested 1,80,000 tests. So population ratio wise, India is a pioneer country in the world for having percentage of population being covered by the tests it being done. So in Rajasthan, we have a capacity of doing 50,000 tests per day overall. So it is a very good capacity we have. We have enough tests available, and probably ratio wise, we are better than many of the European and US condition in the testing ability. So ratio wise, we are much better.
Fantastic. Doctor, if you allow me, can I ask some questions to Anil at the other end? Who
Yes,
was
yes,
your
sure. In fact, I'll be very happy to have Anilji's
Anil,
experience.
excellent. So, Anil, how are you? Yeah, Anil, you need to unmute yourself, please. So, firstly, congratulations on your recovery and a round of applause to you. And thank you very much. You're a brave man to come for this session. And I hope you're feeling very well and better. So tell us, Anil, from your point of view, as a patient's point of view, how did you detect it? You know, when you figured out that you have what did you do so that we can learn from what you did or what you didn't do, either or.
So first of all, thanks Chirag for inviting me, and thanks Dr. Bhandari for taking care of me in such a good manner that I am here talking you in a nice way. So to answer your question, the first day I had some throat ache, and as usual I started my homeopathic medicine, but it didn't work. And next day I had a high temperature, so I had doubt that I may be positive. I called few of my cousins whom I met 3-4 days in last 3-4 days, and found that one of them was already positive. So then I thought I was quite confident that I am positive, and I got in touch with my family doctor, and he started my medicine accordingly to the COVID.
Right. And then what happened? Now take us to the next step that you know, before you got into the hospital, as we know that you went. So tell us what happened so that we know, you know, what you were thinking and, you know, what your family.
So first of all, I went to a complete isolation as doctor is suggesting, and I was strictly staying away with everyone in the house. I was taking food. The food was serving outside my room, and I was taking it myself. And I was using separate bathroom, and my clothes were taken away by someone in the family with the gloves and mask and everything, and putting in the sunlight for a few hours, and then washing with the hot water. I was following the complete isolation and taking the medicine few days in the house, assuming that I'm in those 80% category which doctor is suggesting, and I will be recovering in few days. But later on, I discovered that I am in that 17% category.
Right. So tell us. So as you discovered, what did you do? What were the things you did? Whom did you call? How did you get into the hospital? What did Devita do? So, how did you panic? You know, we need to know about all of that.
So I continued those medicines like hydrochlorine and whatever the doctor was suggesting for home isolation for 10-12 days, but my temperature was not coming down, and I was monitoring temperature and my oxygen level every few hours. But after 10-12 days, when my oxygen level started coming down, then I thought that now it's time to go to the hospital.
Right.
So obviously the next question came to which hospital.
Right.
So there are very few hospitals in Jaipur who are taking COVID patients, and few privates and one RUHS. So I got in touch with Dr. Bhandari, and he suggested me to come to RUHS. So initially I was little scared because we all have a certain image in our mind about the government hospital, but doctor gave me comfort, and I went there, and surprisingly I found that it's better than any private hospital.
Oh,
all
excellent.
the facilities, all the
excellent, fantastic.
So I was so happy to see, and I was so happy with my decision, Doctor, that all the staff were dedicatedly taking care of each and every patient. All the food was served there, and you have a choice to get food from home. Breakfast, lunch, dinner, everything was served there. 2 times tea was served there, and all the staff were coming in PPE kit, even cleaning staff, food serving staff, nursing staff, doctors. And I was constantly in touch with the family on video calls and everything.
Right. And when you were there in the hospital, just talk us about the facilities briefly, and also in terms of treatment protocols. Were you thinking that you were a VIP or normal, and what were you seeing any differences? What was your feeling? What was your thought?
So the infrastructure is a world-class infrastructure. There's no doubt about that. All the facilities were very good.
Sorry, can I interfere? I'll support it. If you can see, I'll show you the institute which you are using. Can you see in my mobile? Can you see? This is our institute. Can you see this?
Yeah, I think everyone goes to a speaker view, they'll be able to see it. If you go on a speaker view. Yes, doctor, I can see it.
This is the institute where Anilji was there.
Wow. Yeah.
We have taken over, SMS has taken over this institute.
Right. This is better than some of the 5-star hotels where we do a retreat, doctor.
Yeah, definitely. The infrastructure is very good and it is well maintained. The cleanliness and everything was very good. And the most important part, I was suffering from high temperature for 10-12 days, and within less than 24 hours of admitting there, doctor was able to control my temperature and it was normal. And since then, it is normal from last 14 15.
Anilji, if I recollect, you were given tocilizumab. You were given, am I correct?
Yes, some injection.
We managed to give that tocilizumab late. We managed to get. Okay.
Yeah, so there's some steroid
injection. Very costly. Anilji is we have been using one of the latest monoclonal antibody, tocilizumab, and probably that was a game changer. We used immediately. You came and we gave you.
And it worked very well. Even less than, I say 15 hours, my temperature gone, and it never came back.
Right.
So I think this is the experience of Dr. Bhandari and his team, and hats off to them.
No, I think it is very assuring, Anil. I think for all of us here that, having heard this from you and doctor as well, that, we appear to be in a right city, in safe hands, compared to a lot of horror stories we hear across India, right?
Absolutely, and I saw the patient adjoining to me in the ICU was from different cities of Rajasthan, from Bhadpur, from Bikaner, from Udaipur. So I think they all who are critical, they came to the Jaipur and get in touch with Dr. Bhandari.
Okay, fantastic. And tell us now that you are at home, care at home, how are you in touch with Dr. Bhandari? What are some of the things you're doing to make sure that you follow the protocol and you're not taking this lightly?
Yeah, so I'm in constant touch with Dr. Bhandari's team, and even I can't believe that they follow me. If I forget to message them or call them, right, they call me, which you cannot find in any private hospital.
Right.
They call me that you were supposed to do this thing today. Did you do this or so? So even after coming from the hospital, I'm in constant touch, and they are guiding me what to do, what not to do.
Right.
So this kind of services they are doing, so I don't have words to appreciate them.
Right. And equally, I'm sure you have very good, kind words for your wife Divita and your family as well. I'm sure. Anil, do you agree with that?
Yeah, definitely. They all have worked very hard.
Yes, absolutely. So we can.
No, I must share with you, very caring wife. In fact, I think he's very blessed to have such a caring wife, I must tell you.
So congratulations to you, as if you're there on the screen. All of this effort goes to you as well. So if I were to steer back to you, doctor, is there something we as TiE could do within our own community, like a self-help group? We are seeing a lot of them doing it across the world, helping each other. Is there something you would recommend?
Yes, I think I would recommend mostly that now what is happening, the fear psychosis have gone down, the confidence levels is built up, people are getting better and better, but they should not dilute our endeavor for interpersonal spirit. So the biggest thing is that Each one of us need to follow the protocols of masking, social distancing, and hand sanitizing and care. Because this is the reason, if you extrapolate American incidence to Indian population, look here, with a population of 15 crores, they had nearing a lakh of mortality and death. We are 8 times US. So practically we have managed this issue so well. We have really concentrated so well. We have researched it so well that we have been most aggressive in introducing the non-pneumonia protocols and saving our patients so well in the rest of the world. Can you believe? You can, so that's a reason. So morally all of us need to enforce that interpersonal spread has to be checked over next 6 to 8 months so that it is contained. Number one. Number two, all of us need to protect our elderly population. We have to confine our parents and grandparents to home. We have to ensure them that they should protect themselves for 6 months. Thirdly, my strongest advice will be to diabetics, hypertensives, cardiac patient, and all other people with comorbid condition to never ever skip your basic treatment and to maintain your all parameters normal. This is very important. And if we can prevent the interpersonal spread by spreading the message of not spreading it, we have to be. We do see a lot of casual approaches, casual attitude, and this should all be forbidden and they should all be propagated, that one need to prevent the interpersonal or community spread, number one, and to protect our, and especially all of you should take a vouch against smokers and tobacco chewers. Smokers, suppose a smoker is accidentally COVID positive, with every puff he will pollute the atmosphere around. If a tobacco chewer accidentally is COVID positive, wherever he spits, the COVID virus remains alive for 5 to 6 days or 6 hours. So one need to be very careful about it. It is of utmost importance.
So I think, doctor, on a slightly lighter note, that obviously exhaling is bad because you said, the germs are propagated. But I think inhaling or drinking, clearly, as you're saying, that over the next
Not drinking. I did not say anything about drinking.
I was just leading that question to you, doctor.
Yeah, no.
Clearly, next 6 months to 12 months, our ability to socialize and meet, as we often do, I think that is something which is...
I would say we need to follow the protocols. Now, if the protocols of social distancing, so rather than telling not to socialize, just follow the protocols in every walk of your life. Once you talk of social distancing and masking, obviously you'll not go over a fancy function. So follow the protocols, implement protocols in all the likes and dislikes. Probably we'll tide over the crisis. And probably we are almost near to the very specific treatment, best modalities of treatment. And secondly, you could spread a message as a TiE, you said, please motivate people who have COVID recovered, come forward to donate COVID plasma so that we can save more and more lives. We have been getting n number of patients now from Delhi, Agra and nearby states, having learned the intense modalities of treatment Rajasthan or Jaipur is offering. We have been getting n number of patients from Delhi, n number of patients from Agra and nearby states. And this is our SOP, that we have been using a lot of COVID plasma. So just like a blood donation drive, you could spread a message that COVID recovered patients get themselves examined. All the protocols are followed, that they are eligible to donate, they are healthy to donate. Probably they can save many more lives.
Absolutely. So we will take that up as a mission from TiE Rajasthan to propagate and permeate that as well. And in terms of self-help groups, sometimes a lot of people think that, should we discuss it? Say if I'm found, God forbid, I'm found with COVID positive. Do you think I should be embarrassed, or should I?
No, nothing. Always remember, even if someone is accidentally COVID positive, there's nothing like that. You need to be very confident in your knowledge. Make sure that you follow all the protocols of protecting your family, friends, and people around. Just be in touch with a doctor, manage it very nicely, and every cloud has a silver lining. Look here, what I'm telling you, even if someone has come accidentally, like Anilji, you pass through a type of like difficult times for COVID, but now you are immune. You have developed enough antibodies, so you are now the safest of the lot. You got my point. So every cloud is a silver lining. A COVID infection introduces immunity also in you, makes you develop the antibodies also you. So there's no reason. Only thing is that there's nothing but to follow the protocols to protect your family, friends, and society at large.
Doctor, if you allow us for a few more minutes, there are a lot of people who would like to ask directly.
Sure.
Chirag, I want to add one point before.
Yeah, sure, Anil, go ahead.
Yeah. I missed to add that as you all know that it's a government hospital, so everything was free there. All the food, all the meals, all the medicines, PPE kits, everything was free of charge. Which, if you go to any private hospital, they will charge lakhs of rupees. And for my surprise, when I was discharged, my wife Devita tried to tip some of the staff, and none of them took any step.
Wow, fantastic.
I must tell you, what it is any of our international friends, they see the type of facilities and our dedication. This is unbelievable. Can you believe everywhere we offer unlimited protective equipment and PP kit to the family members. Please, as consume, pick up PP kit, go to your family members, like everything on the house. Even like, I think this is a very satisfying thing. And we really feel happy that Anilji appreciated this. And I think very nice of you. And this is for everyone who comes to our institute.
Yes.
But I'm sure we can create some sort of a charitable process also, Anil, right? That, those of us who
we should definitely, we should do that.
Also create a self-help group and try and make sure that some of the poor people are also benefiting from this. Right. So the floor is open, Doctor and Anil. We have unmuted everyone. So those of you who have some questions, please fire away directly.
So Dr. Bhandari, Atul Kapoor here.
Hi, Atul.
Hi. So, when you say comorbidities, a lot of us may not be diabetes patients, but may be taking some sugar, tablets or, a little bit of just the tablets we are managing. So are we at risk? And if we have elders and newborns at home, then, is it okay for us to go out to work and then come back and meet the elders and newborns?
Yes. First of all, before I answer your question, I must share with you, drinks are not forbidden. They are allowed in COVID. Okay. So this is for Atul, that drinks are allowed. Okay. So it's absolutely fine. Atul, when you travel back from your office to home, I'm sure you are very careful when you are going to office, handling there, etc. But since you have elderly parents and children at home, it will be prudent that you first go, change your clothes, take a shower, and then you mix with them, just to be overcautious approach, because we don't know that in your outing, you might have come across any asymptomatic passerby, any asymptomatic person who might have stained your clothes with the virus, etc. So just it will be prudent and more reassuring that you just change first, clean yourself, take a shower, and then you meet your children and parents.
So Chirag, one question from me.
Please go ahead.
So you mentioned number of times self-help group. So one thought that I wanted to ask you as well as Dr. Bhandari, who has done a phenomenal job, is should we not proactively form a wellness support group of TiE when someone like Anil is there and other people that are interested, so that periodically, maybe once a week, and then we bring some expert knowledge once in a while, and then also support others. So if we want to do that proactively, we have done something similar in Silicon Valley that has been very useful. So that will be my thought.
Thank you. Thank you, Narenji.
Sorry. I forgot to answer Atul's one question of small tablets of diabetics and well controlled. Atul, if your diabetes, blood pressure, or any other thing stays well controlled with the medication, someone is as good as a non-diabetic or a healthy person. So the bottom line is that if you have anything issues, which is very common after 40s and 50s, so never feel scared or upset. Only thing is that whatever issues you have, keep them well controlled, whether it is a blood pressure or a diabetes or a cardiac problem or a asthma, with the standard care of medications of that disease. So it doesn't makes you more scared of or something. Just keep your basic, if your diabetes is well controlled with minimum medication, perfect. I think no issues at all. You are as safe as any normal person.
Yeah. We feel safe because you are around here. We are,
Yes.
we are very safe because you are here.
Yeah, and drinks have antiviral effect also.
Atul is giving you appropriate answers.
I have a question.
Yeah, please.
So, doctor, does initial viral load affect the severity and the fatality rate? Like, suppose somebody has only 10,000 virus and somebody has, let us say, 1 million virus initially infected. So,
you're telling something more?
no. So, initial viral
Now,
load.
it is a very academic question. Definitely, the volume of viral load affects the severity of disease. But it is not only the viral load itself which is responsible for severity of disease, it is also related to your body immunity, body resistance, comorbid conditions, and your other deficiencies in the body. Suppose you are deficient in certain vitamin D3, B12 level, this brings out your immunity, your sugar levels are high, you have been on certain drugs, etc. So the gravity of situation depends directly on the body immunity, your age, your comorbid condition. At the same time, yes, viral, there's no quantitative test, there's no quantitative documentation, but yes, greater the viral load, more chances of getting multiple complications are there. Here, I would like to just, since it's a very relevant question, these COVID viruses enter body through the nose and the mouth through the respiratory tract. And they're just like, if you see any ants, they will come on the sweet thing, because the site, any sweet thing, it will attract the ants. So there are certain sites in the body known as ACE receptors. Now, the majority of these receptors are in respiratory tract. So the virus finds its entry through the nasopharynx and the mouth into the respiratory tract. So you said the virus. So one of the protective mechanism, it is not related to your question, but if someone takes steam inhalation regularly, if you can take steam inhalation after coming back from office or any exposure, steam goes into the nasopharynx and blow it out, and do the warm water gargles, it could be quite protective in your day-to-day exposure. So yes, viral load has a meaning, but there's no quantitative tests to document it.
And doctor, what is the overall infection rate in India? Like, considering that the actual infected people are much more than what is reported.
Yes,
so
you're very
correct. Yeah,
very correct. As I said, 80% are uninfected. I give an example. We stay in a total viral atmosphere. I have no symptoms, but I never got my test done. I don't know whether COVID came to me and went off. I fall in 80%. Many of my colleagues came in. Many of our doctors who have been found to be positive, we have been having meetings with them every day. If you'll have a contact with anyone who's COVID positive, you'll be paranoid. But we meet a number of our colleagues later who are found to be positive. So what you say, the asymptomatic positive could be there in society. As on today, around 1.5 to 2% population has been found to be, but the major chunk is asymptomatic, which may be positive, which may not be positive. So a lot of debate is going on. Should people unnecessarily be tested? I give an example. Every day I get a number of calls. Someone in our group where I went for a meeting was found to be positive. Please get my COVID test done. I request them, don't go for COVID testing. You got my point, unless you have a symptom. So yes, you are very correct. that there could be much more than what number is depicted as a COVID positive, because there could be asymptomatic and who don't get the test.
Chirag, can I?
Vikram, go ahead. Vikram.
Good evening, Dr. Sir.
Good
So
evening.
wonderful to see you today. And
Thank you.
it's been so heartening to see the way you handle it in Jaipur. It's totally hats off to you and the entire administration and your team, Dr. Sir.
Thank you.
And we are really proud of this, Dr. Sir.
Thank
So
you.
one quick question, like how are we observing any difference in terms of susceptibility to infection vis-a-vis rest of the world? Because initially there were talks that since Indians have had BCG vaccine, they are little less susceptible. So what has been the story down the line on that?
Look here, there has been a lot of observations. Over the period of time we'll conclude. The first observation was the most disciplined lockdown by Indians, which never happened in Italy and Europe or America. So that was the one we could break the chain of spread. Secondly, I'll give you, before giving this answer, I'll give you, there are two countries adjacent to each other. That is Portugal and Spain. Have you heard what a big death rate in Spain, what a big number of patients in Spain? While Portugal shares the border with the Spain, and there were practically 1/20th the incidence of death and the disease in Portugal. So there was something thought process which started with that. Portugal is the only European country, like Asian countries, Indian, where at the time of birth BCG vaccine for TB is given. So two adjacent countries, Spain with Portugal, Portugal having 1/20th incidence of sickness and death against the Spain, and Portugal takes the BCG like Indian population. So that was another thing, that BCG vaccination also gives a non-specific immunity, it has been thought. Thirdly, at SMS also we have done the genetic lineage studies, and we have discovered in India there are 10 types of genetic variations of the COVID, and 4 we have discovered in Jaipur. Now it is being debated that there could be our source of viruses have come from Southeast Asia, and which is less virulent than the Asian virus and the American virus. So the work is going on. The virulence means the nature of toxicity of the virus. Thirdly, there is a susceptibility of the population. Caucasians, that is white, they have been found to be responding much more gravely than the Asians, which are responding very well. So there's been few theories, what you say is correct, but to conclude them, it will take time. But yes, there are some observation which shows, and it could be very proactive average. But now you see, with the opening of lockdown, with intermingling of people, we are having increased number of cases like Europe and America. So initial efforts, isolation, quarantine, masking, the BCG vaccine, the resistance of the Southeast Asians, different from Caucasians. So a lot of things are coming into action. So let's see what it turns out to be.
Thank you. Thank you.
Vivindya, can I go ahead?
Thank you, Doctor, for your advice. I'm conscious of the time. So if I can, on behalf of everyone, thank you immensely. And we're extremely grateful for your time. Second, a thought for you, if there's something we as an organization at TiE can do via self-help groups or any other forms as well, please don't hesitate for your office to contact us, and we'll try and do our best. And I'm sure, as things go along, maybe we'll probably do another episode after a couple of months and see where we are at with that. So without much ado, thank you very much from everyone, and hope to see you soon in a party, Doctor, as soon as possible. You'll have to unmute, Doctor. You'll have to unmute yourself.
Thank you very much, Chirag ji, for having invited. It's a wonderful interacting. I'm very happy to see Mr. Anil Agrawal, and the sense of we are so much loaded with the positivity and happiness, because every day number of patients like Anil ji recovers, and what a sense of, because people come with tremendous fear, psychosis, stress, depression, everyone is so scared of outcome of the COVID. And so I think it's such a great feeling we have that our patients are improving. We are sending them happily home. Anilji is one example. We are so happy about it. So take care, protect all the three protocols which I told you, and I'm sure wish you all the best. Happy leaving, learn to live with this happily, and I'm sure there's no reason to worry about it.
Thank you. Thank you very much, doctor. Thank you. Thanks a lot.
Thank you.